Non-steroidal anti-inflammatory drugs, or NSAIDs. We all use them, but how much do we actually know about them? NSAIDs are a class of drugs that belong to the anti-inflammatory and analgesic category. Their unique properties allow them to treat different types of pain from mild to moderate. Because of their antipyretic properties, NSAIDs may be used to treat fevers. Although most individuals use NSAIDs that are over-the-counter, such as ibuprofen and aspirin compounds, there are prescribed NSAIDs such as Celebrex and salicylates. NSAIDs work by blocking the production of certain chemicals within the healing stages of the pain model. More specifically, they prevent the release of the enzyme cyclooxygenase 2, or COX-2. As noticed on the model on the screen, COX-2 is responsible for the release of inflammatory prostaglandins, which also contributes to pain, heat, swelling. During sports, especially in contact sports such as hockey, football, lacrosse, and soccer, athletes are exposed to forces in which injuries can occur, and this pain model begins. Even though they are wearing protective padding in specific areas that may be more exposed than others, there is still a risk of injuries ranging from minor bumps, bruises, and strains to major injuries such as fractures and tears. Therefore, athletes may take these NSAIDs before or after a workout or competition to help reduce any inflammation or pain they may experience. As clinicians, we may recommend to our athletes to take these NSAIDs after an injury to help with the pain and inflammation. But how much do we actually know? What are the side effects? There are many side effects to both the short-term and long-term effects of taking NSAIDs. Some short-term side effects include gas, feeling bloated, and heartburn. However, persistent side effects over a long period of time can lead to major problems within the cardiovascular, renal system, and more commonly, the gastrointestinal system. Some gastrointestinal problems that can occur include gastric bleeding, gastric ulcers, or perforations and obstructions. These GI issues are the most common drug-related side effects in the United States. In a study published in 2000, patients with rheumatoid arthritis who took NSAIDs on a regular basis presented with a risk of GI complications 3.5 times more than those who do not take NSAIDs on a regular basis. And also, there was a 1 to 2% increase in the likelihood of having an upper GI complication such as acid reflux, belching, or bloating in these patients. The long-term use of NSAIDs may not only just affect the different systems within the body, but it can have a great effect on the healing process as well. In a study completed in 2016, it was found based on different research that NSAIDs should only be taken within the first 2 to 3 days after an injury to help the body in the beginning stages of the healing process. If taken long-term for chronic injuries, NSAIDs may have a direct result in the delay of the proliferation phase of healing. During this time, this is when the development of collagen and repair tissue is formed. Delaying this could result in an insufficient healing of an injury. Since NSAIDs have different side effects that impact different systems within the body, especially in the healing process, should we as clinicians be worried about the consumption of NSAIDs in the athletic population? To further dive into this theory, in a study published in 2015, researchers looked at the amount of NSAID use during different age groups of athletes in the FIFA World Cup. In 2002, at the FIFA Men's World Cup, 69% of participants recorded they used some sort of medication during the tournament. More than 50% of those participants recorded they took some form of NSAID during the tournament, with 33% of them noting they took NSAIDs prior to every match. Similarly, at the U20 and U17 Men's World Cup, 60% of participants recorded using some type of medication, with 43% of them reporting they used NSAIDs during the tournament. Because there are serious side effects to taking NSAIDs for a long period of time, as healthcare providers, it is our job and duty to understand these effects and thoroughly provide knowledge to those who may be wanting to take these drugs.